And I'd like to welcome our first speaker this evening, who, as the Minister said, is Dr. Helen Roberts from DEFRA. Helen has a BSc and PhD from the Imperial College in London. She spent 10 years in academia, including fieldwork in Colombia and secondment to Australia, studying neglected tropical diseases, and then several years working for international health NGOs on human health issues such as malaria and school children's health. In 2007, she joined DEFRA as part of the National Epidemiology Expert Group for Outbreaks, and in 2008 she moved to international trade, becoming the head of international disease monitoring and risk assessment in 2010. She's currently DEFRA's policy advisor for non-livestock diseases, including wildlife and new and emerging diseases, and a scientific stroke risk advisor. She leads animal health horizon scanning and risk assessment across several government departments, such as the biosecurity program in DEFRA. And she's an advisor to the G7 health track. She's a member of the EFSA Animal Health and Welfare Panel, and as chair of the UK Human Animal Infection and Risk Surveillance Group. And indeed, as Minister Hackett has already said, we in DAFM are fortunate to be part of that group, and it was Helen that invited us to participate in that group, along with our second speaker this evening, Dr. Margaret O'Sullivan. We've asked Helen to give an overview of the work of the HARES group, and I think it's fair to say just that we in DAFM are very grateful for Helen's counsel on several issues over several years, and we're delighted to work with her, and it's great to get the opportunity to have her share her knowledge with a wider group this evening. So I'll hand over to you, Helen, and I'll just turn off my camera now. So over to you, Helen. Thank you.
Thank you, Damien, and good evening, everyone. Thank you very much for inviting me. I'm very pleased to be part of this process. And oops, I'm just turning it on a little bit too quickly. I won't bother going back to who I am because you'll have heard that from Damien. But so what I would like to do today is to talk through what the HARES group does and to give you some examples of the work that we carry out. And we've started to do a lot more in the last year, 2 years or so, around trying to really implement the One Health practice across government. As a group, HARES has been working on this since 2003. But the COVID pandemic has really brought it out to many people that we do need to work a lot more closely together. And part of that, as we are a government department, of course, what we always like to do is have a proper definition of what we're working towards. And we have come up with this with the other government departments in the UK. So One Health is referring to two related ideas. Firstly, it's the concept that the health of humans, animals, plants, and the environment we live in are all inextricably linked and interdependent. And secondly, and more importantly from our point of view, it refers to the collaborative and sustained effort of multiple disciplines working locally, nationally, regionally, and globally to attain optimal health for all living things and the ecosystem in which they coexist. It's a horribly long sentence, but we did try and get everything in there we could possibly think of without blurring the lines too much. But essentially, when it comes to HARES, let's see, move on. Going to move on.
Sorry, Helen, your choice slides, you're always up on full screen presenter mode.
Oh, okay. Let me see.
Yeah, that's it. Yeah.
Okay, apologies for that. So the HARES group, we are a multidisciplinary group, and stop knocking about. And we're delighted actually to have Republic of Ireland join us, because we have always been of the mind that we should invite as many people along as possible, because we have similar risks and threats, and we should be doing our work together in a collaborative form. So we have recently joined with the Crown Dependencies and with the Republic of Ireland, and try and invite along people from these different areas, from animal health, food safety, and from public health. And occasionally we even invite people along for the environmental health side as well. And it's important that we have somebody who joins the group who's going to have a lot of close working relationships with other people in their area. They're like a focal point for these different discussions that we have. And the meetings are fairly open. So if we have something that we're discussing that we don't always have the right people on the committee, then we can invite other people along to talk about it and to give us that extra information. And it's a really useful model for this way of multidisciplinary working between colleagues. As I say, it's been going since 2003. And during the last nearly 20 years, there have been a lot of different zoonotic diseases and issues that have gone through the group. And it's resulted in some real success stories through it. We carry on, even through COVID, we still managed to carry on the whole way through, having those contacts, making sure everybody's aware of what the problems are and how we're working towards solving them. Now, the main priority for One Health in the UK, I think, was really brought out by the BSE issue. So back in the late 80s, there were so many issues along with public health and animal health, and that just wasn't joined up, and the message wasn't being given to people in the correct way. And in fact, at the height of the crisis, the chief medical officer had accused officials from the Ministry of Agriculture of misleading the public over the safety of eating British beef. And we therefore realised that we needed to have our own voice, doing our own thing, so that the public health specialists talk about the risk to human health, the animal health specialists talk about the risk to the animals. But there still has to be working together because there's crossover. So this system that we've got of One Health and the HARES group is about having that joined up approach, very strong links to one another. And people, when they say who are the members of HARES, how do they get onto it? We've always said that, well, if somebody writes to us and asks and says they think they should be a member, we often think, well, maybe that doesn't, because you don't necessarily have the right frame of mind, because we are a very open group and try and be as non-judgmental about others as possible. And hence why we now bring in environmental health and biodiversity experts, because we are expanding that remit. Our main job is to do risk assessment and to communicate that risk assessment, particularly about the uncertainty and the assumptions that we use. And it's really important that we do this in the best possible way, because those uncertainties and the assumptions can drive behaviour very easily in the wrong direction. And we've seen during the coronavirus pandemic how the wrong information going out, or slightly scientists to say they don't really know the answer to something, how effective is wearing a face mask. If the wrong information goes out there, people very quickly pick up on it, and it can drive behaviour in the wrong way. But we also really want to avoid mission creep. And by that, I mean you don't want to have a public health expert expounding on the risk to animal health and vice versa. It can easily demean the value of that expertise that you've got. And people have certainly, from the science profession, have realised they have to be very careful when talking to the media these days about what's asked of them. So we do several types of risk assessment in the HARES group. We generally sit down and discuss the hazard. Whoever's brought it to the table, decide whether we can undertake an assessment, or if the evidence isn't very good, we'll do a risk statement instead. Or maybe we all feel that it's not necessary to do a risk assessment at that point. It's just a very interesting hazard to note. Our risk assessments are all about the human exposure to an infected animal. So the process that we use goes through a series of questions to take you through a pathway of risk levels. Often the questions are also around the behaviour of people and the levels of exposure. So generally speaking, we will give a risk level at the end that says the risk to the general public will be this, but the risk to people who are in direct contact with the animal, be they farmers, people working in abattoirs and slaughterhouses, or the vets in contact with those animals, it will be a different risk level. We've also changed our process slightly now because we did quite a bit of work on SARS-CoV-2, the pathogen responsible for COVID, with the wild Mustelinae. So that's the group of animals that includes mink and ferrets and polecats. And we realized we didn't actually have a pathway that looked at a mutation event step. So we've now found a way to put that into the process as well, because we were most interested with the mink farming, whether the virus gets into the mink and mutates in a way that then can infect people more. And when we're looking at animals destined for the food chain, we consider animal to animal exposure, animal to human exposure, as well as the consumption of animals, but as separate assessments, because they have conditional qualitative levels and separate methodologies. I'll talk a little bit more about that later on. So our ongoing work at the moment, and I've just put down a few of these hazards that we're looking at the moment and that we have done in the last couple of years or so. The ones in yellow are ones that we're still working on. But most recently, we have been looking a lot at Brucella canis, which is carried in pets, and where we've had a significant rise in the number of cases in the UK because so many people have been importing dogs from Eastern Europe as pets from the rescue charities. We've also got we keep going with the SARS-CoV-2 risk assessments. We've got M. bovis in cats, which again is a problem that seems to crop up quite regularly. And then last year we had some cases of avian influenza that was spilling over into seals and foxes. So we've been asked to do a risk statement for public health about the seal populations and how much exposure people get. And then canine leishmaniosis, we did originally do an assessment back in 2020, but we're now reassessing it because of looking at further afield than Europe. At that time, we just concentrated on the different pathogens that are present in dogs in Europe, but we're now looking further afield and quite a lot of work with Afghanistan with all the current issues there. Other things that we've been doing in other areas of interest, we always are constantly looking at vector-borne diseases. So I'm very pleased that we've got some talks tonight on the tick-borne diseases. Climate change, changing environment will change our interaction with those vectors and the establishment of different vectors in the environment. So really important, a very, very topical One Health area because of that environmental aspect to it as well. We've also done quite a lot of work in the past on pets in care homes and how much of a health risk they are to people, as opposed to the benefit that people get from having pets with them. And while it's lovely that you do have a dog or a cat with you in your care home, you have to be a bit wary of people who decide to take llamas and sheep in, because they will have a very different risk profile with the diseases they carry. Nevertheless, because of the risk of COVID and the potential for animals to carry the virus on their fur, we did ask for pets not to be taken into care homes during the pandemic. Raw pet food, so again, very pleased to see there's a talk on that later on. Very controversial area for a lot of people who believe that their dogs and cats should all be fed on raw pet food, but there's a lot of potential hazards that can be passed on through those. Monkeypox cases as well, where there have been pets in the household. And I'll talk a little bit about our Ebola control plans because we're applying it to other diseases that may come in, these very serious viral diseases that people bring in from abroad. And talking about other things that come in from abroad, exotic pets. It never ceases to amaze me, the sort of variety of pets that people seem intent on keeping. We did have a large consignment of captive birds that came in the other week illegally into the UK, which included a vulture, which was quite surprising. I'm not sure how anybody can keep that as a pet. Chronic wasting disease is an unpleasant TSE, or transmissible spongiform encephalopathy, that you find in wild deer and captive deer in the USA and Canada. And we've done a three-way risk assessment with that. This is what I mean by the concept of saying, what's the risk of us importing it in animal products, getting into our animals in this country? Then it's spreading between the deer and other livestock species in this country. These are prion proteins, so they are quite difficult to deal with. the exposure of people in those slaughterhouses and the game handling establishments in particular, and then the potential for people to consume the meat later on. And so as the first time that we were doing this three-way assessment, we've again had to come up with a process for doing that. And just a couple of years ago, we held a One Health in Action conference, just a day-long conference inviting people from different areas, but to talk about how they are dealing with the idea of actually involving public health and veterinarians and the public in delivering a disease control response. So I'll just talk very quickly about Ebola and the crisis that happened back in 2014 and why we got involved as part of HARES. And it was after a COBRA exercise, Cabinet Office Briefing Room as it's called, where they were looking at potential case for somebody coming back from West Africa and having a pet in the household and what we would do about that. And the reason it was very tricky is because actually the evidence for pets becoming infected is really poor. There's only 2 papers on it, and both by the same group of authors who seem to find that they could get positive antibodies from dogs in particular areas, suggesting therefore that they could have been infected. Antibody response is quite difficult. If you can't detect the actual pathogen, just finding the antibody does not necessarily mean that you've got an infection there. Oops. Come back. What's going on? So I'm sorry, can you still see my screen properly? My own is doing a bit of an odd thing.
Yeah, we can see your screen. It's just gone out of presenter mode.
Oh, okay, let me go back. There we go. So one of the reasons why we had to do it was that in Spain, when they had a dog associated with a nurse who was testing positive, the Spanish authorities decided it was best to put down the dog. Caused a lot of problems for the Spanish authorities, and was it really necessary to do that? However, in the USA, where they had a dog that belonged to a nurse who had tested positive for Ebola coming home. Oh, stop it. Sorry, I don't know why it keeps doing that. They put the dog into quarantine. And it cost a lot of money, but they did that, kept the dog in there, barrier nursing for the dog over a period of 3 weeks. So we had to do something similar, discussing about what we would do in that situation. And we decided that actually you've got 3 options with these pets. The dog remains at home with the other family members while they're all testing negative for Ebola, then of course the dog should be as well. Or you can transfer the dog to a suitable quarantine facility, or you may euthanize the dog if it's felt very necessary to do so. And you have to back all these things up, all of these decisions, with a risk assessment. So we did a very in-depth one, both the risk management plan and the risk assessment, about the likelihood of a dog being exposed to somebody who was infected with Ebola and how long that viremia could persist if the animal was infected. Would they shed? What about the other people in the household, and so on? And as a result of that, we did come up with a whole management plan, as you can see here, the different steps that have to be taken around case assessment, case management, case review. And we also put in place a quarantine facility with barrier nursing if we did have any pets involved, and we didn't. But this really did bring it to a fore in terms of how much we have to work together and how much we should be showing that animal health and public health systems can be have to work alongside one another. So we're still continuing to do a lot of work on COVID, and that's because we don't know the source of this pandemic. We are convinced that it's an animal reservoir somewhere, but we don't know whereabouts it is. It could be in fur farming animals in China. It could be in some of the exotic animals that they eat and that they have in the live animal markets there. We need to understand the source so we can find the next one if it's going to happen. And we want to make sure also that we don't blame animals by mistake. So we don't want people to go out there and just catch every bat that they can find and kill it to look for these particular viruses. But we want to make sure that wildlife, people who are in contact with the wildlife, are very much aware of what the problems could be. Anybody working with animals, if it's necessary. Are there any concerns around handling food producing animals? Because you have seen in the USA that many of their deer populations have tested positive for COVID, probably because of the very close interaction they have and the feeding that a lot of people do with these deer that we don't do in Europe so much. So the results of all of these assessments we've been doing for COVID are that pets are likely to become infected from contact with humans. So care homes were a concern. Livestock more likely to be infected for pigs. Deer also, rather than other animals, and a paper's come out today so it's showing that sheep, for example, are not very susceptible. For the mink, we don't have any mink farming in the UK anymore. That was banned a few years ago, but we still think that ferrets would be susceptible, so we need to understand our ferret breeding population. And we've now seen that badgers, if you do some work on them in silico, meaning if you take the computer pathway for looking at these risks, then you can see that they would be susceptible. So providing guidance to wildlife workers about not going near badgers if they have got COVID symptoms at the time. And we're now looking at the deer populations to see how different they are to those in the USA and make sure that we're not finding a reservoir species there. And rodents is the other interesting one, and we've done recently a paper for SAGE, the Science Advisory Group, looking at how we bring in the environmental health risk as well, so that we're not just thinking animal and public health. This is where we're finding that rodents could potentially be exposed to quite high levels of SARS-CoV-2 virus in the sewage system. And we were trying to work out, it's all very well being exposed, but would they become infected? And if they did become infected, would they have any opportunity to have contact back with humans again? So again, we go back to this idea that actually the end point depends on your job and your role. If you're the general public, presumably you don't have that much contact with rats, I hope. But if you are working in the sewage business, then you probably have a lot more contact than others would. So I will finish on that, and just to make a couple of conclusions from this. It's really important that you communicate from anything to do with public health or animal health. The communication is absolutely vital. And it also maintains public confidence. If we can be open and transparent with our messages, then that's the best way to bring people along with you to understand the message that we're putting out there. And the use of behavioural science to pull, not push, I'm quite keen on, because don't tell people what to do. Make sure they understand why they're doing it. And people will be a lot more compliant, whether that's in the public, going out wearing a mask in a restaurant, or to, well, it's been the rugby this last few weekends, and the number of people not wearing masks at the rugby. But also the other one, which I do often say to my public health colleagues, is that One Health is not one-sided health. It's very quick when a big public health issue happens that it's immediately our public health colleagues who think it's all about them. It's not. There's so much expertise in the veterinary side, and there's so much that the public and the animal keepers that they can do as well, that it shouldn't just be picked up by the medics and by the people in the public health systems. Transferable skills, working together, communicating with one another is absolutely vital. So on that, I'll say thank you very much, and I'll stop sharing.
Okay. Thanks very much, Helen, for a very comprehensive talk and showing us that the roles of all the disciplines in One Health, and it never ceases to amaze me all the potential risks that are on the horizon that we're probably not aware of, and that certainly the public are not aware of. So it's good that somebody is watching out there. So if there's any questions for Helen, you might put them in the question box, and we'll leave the questions till the end after all four speakers. So